Okay, you're on.
All right, here's my note cards. Here's my outline, sleep apnea, and 4-minute speech. Let's go. All right. Ready? Good morning, everybody. I hope that you've all slept well last night. I know I sure did. But for me, it wasn't always that way. About 8 years ago, I was diagnosed with what's called critical sleep apnea. I had a wonderful family doctor that I had begun seeing, and she'd always listen to everything that I had to say. One day, she called me into her office, and she spoke to me about this thing called sleep apnea. She wanted me to go take this sleep study to see if sleep apnea was the cause of the problems that I was having at the time. So I went ahead, I made the appointment, did the sleep study. The outcome was I have critical sleep apnea. What does this mean? It means that, for me, I stop breathing approximately 97 times every hour when I'm asleep. Little did I know what sleep apnea was at the time. I knew 2 things, though. Number 1, I was scared. Number 2, I had no idea what it was. So I did what every red-blooded American would do at the time. I hopped on the internet, and I did my research about what sleep apnea was. According to ResMed, 75% of severe sleep disorder cases go undiagnosed. In America alone, there are approximately 42 million Americans that have one form or another of sleep apnea. In the next few minutes, I'm going to briefly go over what sleep apnea is, signs, symptoms, and treatments for it. Sleep apnea is a very serious sleeping disorder, and it occurs when a person's breathing is interrupted during their sleep. If you look at the first diagram, the airflow isn't blocked. It has a normal flow. In the second diagram, there's blocked airways, which is causing sleep apnea. It's when the soft palate collapses down and obstructs the flow of air. Untreated sleep apnea, a person may stop breathing more than 100 times during their sleeping cycles. What does that mean? It means that there's not enough oxygen getting to the person's brain or their body. And over time, this could be very detrimental. There are 2 types of sleep apnea. First, we have obstructive sleep apnea, which is what I have. And it's caused by the blockage of the airway, usually with its soft tissue going backwards and collapsing. The second one is central sleep apnea. Unlike obstructive sleep apnea, the airflow is open, but it's the brain at this point that fails to signal the muscles for you to breathe. Next, we're going to go over some signs and symptoms of sleep apnea. First, extremely loud snoring, morning headaches, depression, restless sleep, excessive sleepiness during the day, and gasping for air or choking during your sleep cycles. The signs and symptoms of sleep apnea are not to be taken lightly in no means. If you, a family friend, or a loved one experience any of these, please have them contact their doctor and talk to them about it. Personally, I was really lucky that I had a doctor that was willing to sit down and listen. And through her listening, she was able to diagnose me with sleep apnea. I used to wake up constantly during the night. I would adjust my pillow or pull up my blanket and thought that was normal. But my doctor explained to me, no, that was your brain waking you up, saying, wake up and breathe. There are several treatments for sleep apnea. First, we have what's called a CPAP. The Mayo Clinic states that CPAP is a continuous positive airway pressure therapy, and it's the most common treatment that there is for sleep apnea. What this consists of is a small machine, and it delivers a positive, steady flow of air through a small hose that's connected to a mask or a nasal plate piece. Then you have surgeries. There are several different types of surgeries that are available. Nasal surgery, soft palate implants, and tongue advancements. Another form of treatment is using an oral appliance. The American Academy of Dental Sleep Medicine states that an oral appliance is a therapy that is very effective when used with sleep apnea. To recap everything, sleep apnea is a very serious disorder. If you or a loved one experiences, please talk to your doctor. If sleep apnea goes untreated for a long period of time, it can be detrimental to your health. Just remember to talk to your doctor. About 8 years ago, I had my very first night's real sleep. I slept. I didn't stop breathing. I was on a CPAP machine, and until this day, every night, I press my button, put my mask on, and I sleep soundly. Thank you.